The Pregnancycare Show is proudly brought to you by
Cerelac. It's all good, Mom.
During the journey of pregnancy, some women tend to develop or meet certain conditions that was not a part of them before the pregnancy. As individuals, yours may differ from mine. Worldwide, some women develop hypertension during the period of their pregnancy, and this is called pregnancy-induced hypertension, PIH, which is diagnosed after 20 weeks of the pregnancy with previously normal blood pressure. How did I develop a PIH? How does it affect me and my unborn baby? How complicated is it? And how will I be managed and treated when I fall a victim to PIH? Hypertension is one of the most common medical conditions encountered during pregnancy, and it complicates about 2 to 3% of pregnancies according to a research. Pregnancy-induced hypertension, PIH, is one of the major causes of fetal and maternal morbidity and mortality. Women with this condition are at greater risk of developing most pregnancy complications like placenta abruptio, organ failures, and many others. Pregnancy-induced hypertension has a prevalence of 7 to 10% to all pregnancies. Welcome to the Pregnancycare Show. My name is Dede. Welcome. So on this week's episode, we have a doctor with us. He's going to take us through everything PIH. Hello, doctor.
Hello.
You're welcome to the Pregnancycare Show.
Thank you.
Okay, so for the sake of my viewers, we want to know your name, what you do, and where you work.
Okay. My name is Dr. Resh Apiankroma. I'm a medical officer at Snell Specialist Hospital. And in this facility, we tend to see a lot of obs and gynae cases. So I'm happy to be here to discuss PIH because it's one of our cases that we tend to see a lot.
Okay, so that tells us that it's quite common.
Yes, it is. It is quite common at our facilities and other facilities as well.
Okay, so thank you for coming on our show. So when we talk of pregnancy-induced hypertension, what do we mean by that?
Okay, so when we talk about pregnancy-induced hypertension, the term itself is a collective term for various types of hypertension. So under the pregnancy-induced hypertension, we have gestational hypertension, we have chronic hypertension, we also have preeclampsia, and we have eclampsia as well. And we even have chronic hypertension with superimposed preeclampsia. So the pregnancy-induced hypertension, or the PIH, is just an umbrella, a big umbrella, which houses all these types of hypertension. But basically, it's when you have a high blood pressure that's above 140, that's for the systolic, and then 90, that's for the diastolic. Above 90, it is measured at least 4 to 6 hours apart. So you should have 2 readings. And when you have that and it's still high, then you can say you have some sort of pregnancy-induced hypertension. And it should be after 20 weeks. Yes, so pregnancy-induced hypertension, it should always be after 20 weeks. If it's anything less than 20 weeks, then it means the patient was already having some existing hypertension which was not diagnosed.
Okay. So with the induced there, does that mean that the pregnancy is what is bringing about the hypertension, if I should get it clear?
Yes, so with the pregnancy-induced, the induced means that the pregnancy is what is causing the hypertension or the other forms of the hypertension.
Okay.
If the pregnancy wasn't there, this patient wouldn't have had a BP issue or a hypertension. So that's what it basically means.
Okay. What to tell a pregnant woman is developing hypertension?
Well, most of the times you won't have any symptom at all.
Okay.
Okay, most of the time. In fact, there are a lot of people walking around, they don't have any symptoms, but they have high blood pressure. If you should check their BP, it's going to be high. But for the sake of one or two things that you should know, it's most of the clients who present with symptoms, they will have commonly headaches.
Okay.
Most of them also complain that they cannot sleep well at night. And then not sleeping well at night also complicates their blood pressure. It makes it even worse. So basically they have these symptoms. It's the most common ones that we tend to experience.
So what are some of the most common signs and symptoms? I think you spoke about headache and palpitation. Are there other few signs and symptoms of that? And how do you even diagnose a PIH?
Okay, so pertaining to PIH, so the patients, of course, with the headaches and then the palpitations, they may present with other things like visual disturbances. They can have pain, the upper abdominal pains,
okay,
or just beneath the rib, the right side of the rib. They can also present with breathing difficulties, and also they can have even some swellings in the legs. Okay, so what we call edema. Okay, yeah, so mostly these are the other things that they present with. And then with regards to how we diagnose it or we test for it. So when the patient comes, we always check their BP. It's very, very important because of its increasing prevalence now. So we check their BP and we also check their urine for a substance for proteins.
Okay.
Okay, because PIH goes with, or preeclampsia goes with urine proteins present. Okay, so you can have a high blood pressure and then urine proteins about 1 to 2 classes or more. And this would give the diagnosis right away that this person is probably having a pregnancy-induced hypertension, whether being preeclampsia or something else, depending on the types of the symptoms he's presenting with.
How common is PIH?
If you take 5 top causes of death, maternal mortality, PIH is one of them. And it's about 10% of patients would have PIH. You know, if you take about, it requires more study, but generally 10% of them would have PIH.
Okay, so if PIH is one of the major causes of maternal mortality, what exceptional or intensive care do you give to women with PIH?
So I'm glad you said intensive care, because that is what we are actually supposed to be doing, or we are supposed to put our patients in that setting. But you know how our health system is. We cannot put all our patients in that regard. So some of the things that we do, apart from the screening during the antenatal period, is that we put our patients on antihypertensives. Sometimes we even put them on some drugs like aspirin, especially when the patient is having a lot of risk factors for the PIH. So we put them on these drugs. We see them more often than usual. Okay, in a normal antenatal patient, you see them from the beginning every 4 weeks, before it gets to every 2 weeks. But for those who have hypertension, you can sometimes see them weekly or 2 weeks, every 2 weeks.
Okay.
So, and we follow them up. I quite remember when we were training to be doctors, some of the patients who had PIH, we had their numbers. We were calling them, trying to find out if they were checking their blood pressures, because we cannot admit them and keep them. They won't even want to be admitted.
Yeah.
Yes. So you have to be calling them. Have you taken your medications? Have you checked your blood pressure this evening? Are you swelling up? You see, you go through all your checklists with them just to make sure that at least you are having some sort of remote intensive care for them. But in other places, these people are followed up quite more intensely. They are being watched, they are being monitored. Some of them come for admission, and they understand because education there is more. Yes, and it's intensive, so they understand. Unlike in our part of the region where people don't even understand what PIH is. Even normal hypertension, they don't even know what it is. If you tell them to come to the hospital to come and check their blood pressure, they won't come. You know, how many of our patients have blood pressure machines at home? You see, so we are just trying our best, but with time we'll get there.
Okay, so you putting them on drugs, are there any extra advice or things you make them do, maybe in regards to food, the kind of job they do? Are there any extra care you give apart from the antihypertensives?
Yes, so apart from the drugs, we tell them to have a lot of bed rest because it has been shown that it sort of slows down the progression of the disease.
Oh, okay.
Yes, so there are some patients where we admit them till delivery, where we normally term it as no baby, no home. It's a funny term that we use because it's been shown to slow the progression of the disease. In terms of diet, we advise them not to take foods with a lot of sodium, like salt. They should drink a lot of water, but they should avoid high sodium or salt intake. They should eat a lot of fruits, you know, and avoid the junk food, the fast foods, the oily foods and all that, because they all contribute to that.
Does it resolve after birth?
Yes, so some resolve, some don't. It all depends on how the condition progressed, its management, the interventions that were taken on early, and even its diagnosis, how it was picked up early now. If it was picked up early and it was managed well, you are most likely not to have it persisting after delivery. But quite a few do persist. And patients like that, you have to follow them up because you can't really tell which patients will have their hypertension or PIH persisting. In fact, there are some patients who tend to develop PIH after delivery.
Yes, that brings to the next.
So you have to monitor or follow them up for about 6 weeks, sometimes 6 to 12 weeks, to make sure that they are fine. Yeah.
So hypertension is a serious and a major concern in pregnancy. If you are diagnosed of such, make sure you take your drugs, speak to your doctor, and always see the doctor as and when. We'll go for a short commercial break. When we come back, we'll hit the street to find out what our viewers have for us on today's episode.
In the first 2 years, your baby will experience amazing growth in so many ways. To fuel it, they need the right nutrition. With Cerelac, 1 bowl of goodness a day provides the wholesomeness of carefully selected grains, the Iron Plus, which helps support brain development, and the yummy taste baby loves, assuring you the right nutrition in 1 bowl. Cerelac, it's all good, Mom.
This advert is FDA approved.
Welcome back. If you just joined us, it's still the Pregnancycare show, and we are looking at everything pregnancy-induced hypertension. So let's hit the street to find out what our viewers have for us.
I'm Christabel. I'm speaking from Dansoman. I want to ask the doctor, is PIH a family disease?
Me pacho me wa Dansoman market. Na ye frame me kesiye ni na 1 cedi. Na me wa question ma doctor. Se me pese me bisa ne se obi enya PIH da. Na so onyim a. E possible se obetimi asan nya biom ana.
Ye frame me Felicia, ko se free bantema. Se me busa say PIH ma cross abortion ana.
Welcome back. If you just joined us, it's still the Pregnancycare show, and you are looking at everything pregnancy-induced hypertension. So, Dr. Apia, these are some questions from our viewers. They would want to know a little more on this question. So, one person is asking, is PIH a family thing, or is it family related?
Yeah, so it is not a proven familial disease. However, if say your mother has had or had PIH before, there's a possibility you can have PIH. Okay, it is not for sure that you have it, but it has been shown it's a risk factor. There's some association that you can have it. If there's a family history of hypertension, also you are at risk of having PIH. Yes.
Okay, so our next viewer, she's asking, am I at risk of getting PIH again if I've had it before? I think you answered this, but for the sake of our viewer.
Yes, you are at risk. You are at risk of having PIH again if you've had it before.
Okay, so our next question is, can PIH cause abortion?
Yes, it can cause a lot of abortions. That's why we need to treat it and screen for it.
Okay, so I hope we got our questions answered by doctor. So Dr. Pia, how dangerous is PIH to the mother and even the unborn baby?
Yeah, PIH is seriously dangerous. Okay, so for the mother, it can cause fits or seizures if the BP is not controlled. It can cause even a condition we call the HELP syndrome, where the liver is compromised. There are some components in the blood work, like the platelet, that is also compromised. And it's telling you that multiple organs are failing due to the condition. Aside that, it can even cause some irreversible eye problems. You know, that's for even the mother. Of course, it can cause death. You know, some patients even experience strokes from that. And as for the babies or the fetuses, they tend to have what we call IUGR, which is intrauterine growth restriction. So you have a baby who is small for the gestational age. And patients who have PIH tend to deliver these babies prematurely.
Surely.
Yeah, and then you know the problems with premature babies, a whole lot of problems. I must add that mothers who tend to have PIH too, later on in life, they can have hypertension. So it's like a risk factor to have full-blown hypertension later on in life. So it's quite a serious condition that we need to take note of.
Okay, so what are the options, birth options for women with PIH? Probably they've gotten to term or they are getting to term. And let's say hypertension is increasing. What are your birth options for such women? Okay,
before I even mention or tackle this question, I must add that the problem of PIH is also causing an increase in the rate of cesarean sections for us, you know. So it's something that we should. I'm not saying cesarean sections are bad, but it's a surgery, and everybody wants to avoid surgery in any way, and it's a bit of stress even on health workers as well. So the normal Ghanaian doesn't want surgery, but so when they know they have hypertension, they've probably heard that once you have hypertension, you're going to have surgery, so they won't even want to be checked. They won't even want to be screened for it. They don't want to know.
No.
You understand? So the birth options, it actually depends on the condition, the state of the patient. If the patient's blood pressure is very well controlled, the fetus is not compromised in any way, baby is doing well, mother is doing well, he's taking their medications, they are, and the cervix is actually favorable. This patient is actually a candidate for a spontaneous vaginal delivery. You can even induce, you know, but it goes with close monitoring. However, for those who have not had a very good control, you would not want to subject them to labor because it can aggravate the blood pressure. It can aggravate the whole PIH. So for them, at a very good gestational age, you have a cesarean section for them, and the outcomes are quite okay.
Okay, so with a client where she's not term, but then BP keeps increasing, do you terminate pregnancy or what do you do?
Yeah, so it's a very tough one, and as clinicians, we should have it at the back of our mind that whatever be the case, the mother must come out alive and safe.
What of baby?
So you have to try your best to save both. Okay, you are giving your antihypertensives, you are checking the mother, the blood pressure, they are actually hospitalized, you know, they are having their bed rest, but their blood pressure is not coming down. And it is, you foresee that this is going to be a problem for mother. If you do not intervene, the mother can have a seizure or can have a stroke and die. Okay. So sometimes you have to sacrifice the baby. And what I mean by that is you have to terminate it. You have to terminate the pregnancy. It's a tough decision to make, but it saves the mother, and it can give you the opportunity to try another pregnancy again. And this time, when you are trying the pregnancy, you make sure that you screen early. The control of the BP is started early, so that we do not get to the point where you have to terminate or sacrifice the fetus. But it's a very tough decision, and sometimes that is the only way out. But of course, we do not arrive at that decision by just on a silver platter. You try your best. You do everything possible. You try everything in your arsenal just to make sure you can save the baby, or you can prolong the pregnancy to a certain point and deliver. Because if you do not do that, the baby can just die, or the mother can have a fit, and then now you have a patient who has a fit, or she's having multi-organ dysfunction, and a baby, the baby is almost dying or is dead, and you have yourself to blame. You know, so sometimes you have to take some decisions based on whatever you are facing with.
So with all these complications, I think let's advise ourselves to adhere to all treatments when you have pregnancy-induced hypertension. I do not wish or think that any woman would want to go through all these complications. And remember, it's one of the major causes of maternal and fetal mortality and morbidity. We'll go for a short commercial break.
In the first 2 years, your baby will experience amazing growth in so many ways. To fuel it, they need the right nutrition. With Cerelac, 1 bowl of goodness a day provides the wholesomeness of carefully selected grains, the Iron Plus, which helps support brain development, and the yummy taste baby loves, assuring you the right nutrition in 1 bowl. Cerelac, it's all good, Mom.
This advert is FDA approved.
Welcome back. If you just joined us, it's still the Pregnancycare show, and you are looking at everything pregnancy-induced hypertension. So, Dr. Pia, one of our last questions: what are the preventive measures put in place to curb or control PIH?
Well, what do you think? We are already in the process of the preventive measures. Okay, so our antenatal screening of patients, we check their blood pressures every single time that they come. We also check their urine for proteins, okay, because these things would give you the diagnosis most of the time. We also try to, when they come for the antenatal, we also try to educate them on the reasons why they are checking their blood pressure and their urine. And then sometimes we have antenatal talks with them. We have selected topics that we talk about, and always pregnancy-induced hypertension is part of it. You know, we also even try to bring patients who have had an experience before to talk to some of the mothers, share their experiences, you know. We also let them see the dietitians to talk about their diet. And then also, most importantly, after delivery, we screen them up, we follow them up. Within the 6 weeks, and after 6 weeks, we try to follow them up. These are some of the little things. They look little, but they're actually mighty things in the right direction in stopping or preventing the prevalence of PIH. Yeah. So I think Ghana, we are doing well. We are doing well in the screening. We are really doing well. A decade ago, we had a lot of mortalities
from PIH.
But now the mortalities have steadily declined. Okay, and we are even awarding facilities who are recording 0 mortalities on PIH. We are giving them incentives, so everybody is like on the edge trying to do something to prevent it, because there's motivation, and in the long run it helps our patients. It helps them to have a healthy life. They don't have anything to do with hypertension anymore.
So let's look at some tips for today's episode. Try to reduce eating foods containing so much sodium or salt. Enough rest per day is encouraged. Limit your alcohol, caffeine, and smoking. Do well to frequently check your blood pressure and adhere to all treatments given to you by your doctor, especially your antihypertensive treatment. Report to the hospital with any unusual feeling like persistent headaches, blurred vision, frequent fatigue, restlessness, and excessive weight gain. So those are some tips to help us reduce or manage pregnancy-induced hypertension. So Dr. Pia, can you look straight into the camera? Give us any detailed information on anything you want our viewers to know about pregnancy-induced hypertension. Any advice you have for them?
I just want to say that hypertension in pregnancy is very real, and it can be very dangerous. In fact, it is very dangerous. And if it is not screened, it is not checked, and if it's not detected, most women can die out of it. And we do not want our Ghanaian women to die out of a preventable condition like that. I'm humbly appealing to the mothers or the pregnant ladies or women who are now about to get pregnant that they should go to their nearest hospitals. They should get screened. They should be actively involved in the management of their conditions. They should not just be relaxed about the whole thing. They should read on it. They should ask questions when they come to the hospital. They should be involved, because it's their lives that are on the line. Okay, and so I'm just appealing to them that they should be more involved. Your life is more important. Your baby's life is important. If anything, think about your baby, think about your life, think about the future. So we beg you, please come and get screened.
Hello, Dr. Pia. Thank you so much for coming on the Pregnancycare show.
Grateful.
We are also grateful for having you, and we are looking forward to having you more on our show. I hope your doors are open to us.
Very open wide.
Okay, so thank you very much. So thank you for watching today's episode. We're looking at pregnancy-induced hypertension, and we learned that it is very dangerous and that's serious. So every woman should be concerned about pregnancy-induced hypertension. If you are diagnosed of it, just do well to adhere to your treatment, go for antenatal school, antenatal classes, take your treatment serious, and you are good to go. Remember that it is preventable and it is treatable as well. Your health is a priority. Thank you for watching this week's episode. The show was brought to you by Cerelac. If you have any questions, if you have any comments, can you leave them on all our social media platforms at The Pregnancycare Show. Keep subscribing to our YouTube channels. If you have any question, you can directly send them to my DM at Dedegawu on my IG page. Thank you for watching today's episode. See you next week.